Hello. The Far Northern Regional Center clinical team would like to welcome you to our 29th COVID-19 Prevent, Prepare, Enact information conference call for FNRC providers. This conference call will be recorded and made available on the FNRC YouTube channel. Please note that the information provided today is current as of this date. If you are viewing the recorded video, some information may have changed. We will continue to share important information, updates, and changes on our COVID-19 calls. My name is Jen Badger, and I am the FNRC nurse working out of the Reading office. And presenting with me today is Nellie Camarena, FNRC nurse out of the Chico office. We have a packed agenda, so let's go ahead and get started. So today we will be talking about booster shots, the vaccine mandate, CDPH's antigen testing program, the Federal Health and Human Services Provider Relief Fund, COVID mitigation plans, Cal OSHA and CCLD inspections, investigations, and citations. And then we will take some time for questions and answers. If we have time today, we will also share information on pregnancy as a high-risk condition. But first, we'd like to share some current statistics. So looking at the developmentally disabled and intellectually disabled population in the state of California, this data was updated most recently October 7th and was found on the DDS website. Regional Center clients testing positive has a total of 20,238 individuals. The percentage of those individuals who have tested positive who live with ILS, SLS, or residential placement is 46%, and that number hasn't really changed. The number of client deaths is at 790. The percent of client deaths who live with ILS, SLS, or in residential placement is 75%. So significantly higher than the number of positive clients in those residential settings. FNRC has 474 clients who have tested positive for COVID-19. Of those, 19 have passed away from the disease. Here the numbers are broken down by residence type. 43% of them live in CCL licensed facilities, 26% live with family, and 19% live independently with SLS or ILS services. Here is the breakdown by county, which is essentially unchanged, with nearly half of the cases in Shasta County, 22% in Butte, and 15% in Tehama. Counties considered hotspots due to the rate of transmission are Shasta, Trinity, Tehama, and Lassen. Vaccination data for our region can be found on the DDS website. Nearly half of our clients are fully vaccinated. There are still 36% unreported, and we're working on collecting vaccination information for those clients. Vaccination, as you know, is the best defense against serious illness and death from COVID. FNRC sent out a survey in August to collect vaccination status data for providers' staff. Thank you to those of you who turned in the survey. Not all providers are represented here, but these are the numbers we did receive. As you can see, less than half of care staff have chosen to get vaccinated. Unvaccinated staff not only put clients and others at risk, but also cause a staffing burden during outbreaks when they must quarantine. The Delta variant is highly transmissible, and even though some vaccinated individuals are still catching the infection, they are much less likely to experience serious illness. Unvaccinated individuals are 8 times more likely to catch COVID-19 and 17.5 times more likely to die from COVID. Currently, 99.6% of those hospitalized in California for COVID are unvaccinated. Now I'm going to turn it over to Nellie.
Thank you, Jen. If we can move to the next slide, please. Thank you. So at this time, the FDA has issued an emergency use authorization for the Pfizer vaccine to allow for use of a single booster dose to be administered at least 6 months after completion of the primary series in certain individuals. The CDC continues to recommend that the following groups should receive a booster dose of Pfizer's COVID-19 vaccine at least 6 months after completing their primary vaccine series. So people aged 65 years and older, residents aged 18 years and older in long-term care settings, and people between the ages of 50 to 64 years with underlying medical conditions. In addition, the CDC recommends that a booster dose of Pfizer's COVID-19 vaccine should be made available so that the following groups may receive a booster dose at least 6 months after completing their Pfizer primary vaccine series, based on their individual benefits and risks. So people between the ages of 18 to 49 years with underlying medical conditions, and people between the age of 18 to 64 at increased risk for a COVID exposure and transmission because of their occupational or institutional setting. Last week, the FDA vaccine advisors voted unanimously to recommend a booster dose of Johnson & Johnson's vaccine, as well as an authorization of a Moderna booster. The committee also met to discuss the available data on the use of a booster of a different vaccine than the one used for the primary series of an approved COVID vaccine, or in other words, mixing and matching a COVID vaccine booster. So these recommendations have not been fully authorized yet. Typically, shots can be administered once the CDC director signs off on the recommendation, and the CDC's Advisory Committee on Immunization Practices is scheduled to discuss boosters this week. So hopefully soon, more individuals will be eligible for a booster. Next slide, please. And the slide is showing the underlying medical conditions previously discussed as for those who would be eligible for getting a booster. Next slide. So next, I'm going to talk about vaccine mandates. Again, I know we talked about this at our last call, but wanted to go over it again. As most of you know, on September 28th, a new public health order was issued mandating vaccinations for those working with regional center clients, including adult and senior care facilities and in-home direct care settings. This order takes effect immediately, and providers must be in full compliance with the order by November 30th. CCLD's PIN 21-44 also goes into detail about this new order for staff working in a licensed home. The order and CCLD PIN states that an employer must maintain records of workers' vaccination or exemption status and must have a plan in place for tracking vaccination status. On the next slide, I'm going to talk a little bit more about what's written in the order and in the PIN in regards to vaccines exemptions. Next slide, please. So workers may be exempt from the vaccination requirements under Section 1 of the health order once they provide a declination form signed by the individual stating that they are declining the vaccine for one of two of the following reasons. If we can go to the next slide. So number one is one of the reasons is that the worker is declining vaccination based on religious beliefs, or two, the worker is excused from receiving any COVID vaccine due to qualifying medical reasons. So in the order, it doesn't provide specifications on what is required from the religious exemption other than what it's granted. An employer must maintain records of an exemption. The order does, however, specify what is required to be eligible for a medical exemption and states that the worker must provide to their employer a written statement signed by a physician, nurse practitioner, or other licensed medical professional practicing under the license of a physician, stating that the individual qualifies for an exemption. In addition, it should indicate the duration of the worker's inability to receive the vaccine, or if the duration is known or permanent, so it must be indicated. Please note that the statement should not describe the underlying medical condition or disability. If an exemption is granted for a staff member, the unvaccinated exempt worker must meet the following requirements when entering or working in such facility or home. They must be tested for COVID with either a PCR or antigen test every week and must wear a surgical mask or highly recommend wearing a high-level respirator such as an N95 at all times while in the facility or the home. Next slide, please. So we're going to switch topics now and go over the CDPH antigen test program. Earlier this year, the CDPH task force developed a program for rapid antigen testing and PCR testing in California. On July 20th, CCLD released PIN 21-30 on the availability of this program, known as CDPH's Binax Now antigen testing program for COVID. We wanted to remind you all that this is still available specifically with CCLD licensed adult and senior care facilities types. This program offers a process for providers to obtain a free clinical lab improvement amendment, also known as a CLIA waiver, which is required for any site to conduct antigen testing. The program provides ongoing supplies of the ABBA Binax Now test, which provides results in 15 minutes. This makes it easier for providers to conduct these tests in the home for both staff and clients and receive results quickly. Once enrolled, providers will receive the antigen test kits, an IT platform for reporting to public health, and confirmatory PCR tests from the Valencia branch laboratory. So on the next slide, you're going to see that the reason why part of the program requires enrollment with the Valencia branch is because all positive antigen tests must be confirmed with PCR testing within 24 hours. In addition, a negative antigen test results in a symptomatic person should also be confirmed with a PCR test within 24 hours. Unfortunately, the current lead time to onboard to the testing task force antigen testing program may be up to 6 to 8 weeks, but the site does indicate that if sites want to be on board quicker, within 7 days, they may consider applying to the PCR testing program in partnership with the testing task force. After onboarding to PCR testing, sites may also be onboarded to antigen testing at a later date. So on this slide, you will see I included an email to one of the, if anyone has any questions or anything that they want addressed, the PIN actually has this listed. It's the RCFE binax@cdph.ca.gov, but all CCLD licensed facility types may email them for questions. And there's many benefits to this, one being it's a simple method of enrolling. Once enrolled, the program provides ongoing technical and logistical support. As mentioned, tests are easy to perform. Any staff member can be trained to do it. And it can also be used to offer these tests to screen visitors before they enter the facility. Next slide, please. So earlier this month, the Ellume COVID home tests were recalled after noting an increased chance that Ellume COVID home tests from specific lots may provide an incorrect positive result. Just wanted to bring this to everyone's attention in case you've used this brand. And what they're saying is that for these tests, a false positive is a test result that indicates that a person has the virus when they do not actually have it. However, it is noted that negative results do not appear to be affected by the manufacturing issue. So following a thorough investigation, the company was able to confirm that this incidence of false positives is very limited to specific lots. So if by any chance any provider has used this brand of rapid tests, we would encourage you to check the Ellume webpage to see if your product has been affected. And it's a little bit hard to see, but the website is on this slide. It's www.illumecovidtest.com/return. Next slide, please. And then wanted to share one other announcement in regards to the Federal Provider Relief Fund. So at the end of September, CCLD released PIN 21-19-CCLD, informing providers of the availability of a COVID-19 Provider Relief Fund. We wanted to inform you all that there is still time left to apply for the COVID-19 fund made available through the Federal Department of Health and Human Services. $25.5 billion in funding will be distributed by the Federal Department of Health and Human Services, and the deadline to apply for funds will end on October 26. Providers may use these payments to cover eligible healthcare-related expenses or lost revenues that are attributable to coronavirus that incurred between January 1st of 2020 and the end of the applicable period of availability. Providers have at least 12 months and as much as 18 months based on the payment received date to control and use the payments for expenses and lost revenues. The website is on this page if anyone's interested in looking. It's the www.hrsa.gov/provider relief/future payments. It does indicate that the following providers may apply for these funds, and there's a list, but I wanted to pick out the two that are applicable to the individuals in this call. So it's any provider or supplier of healthcare services and support in a medical setting, at home, or in the community, including but not limited to assisted living facilities and developmental disability services. And so you'll see that on this slide. Again, if anyone is interested, we would highly encourage you to check it out. The website has all the instructions. It has frequently asked questions section, and it also has a contact if you want to reach out to anyone with questions. Thank you. And with that, I will pass it back to Jen.
Thank you, Nellie. So let's talk a little bit about COVID-19 mitigation plans. Every provider should have a COVID mitigation plan. CCLD required licensed facilities to turn in their plans to them in January 2021. On the most recent information call, they reiterated the need to update the mitigation plan as things change and to ensure all staff are trained on the plan. So I'm going to review what components should be in your plan. The plan should include sections on screening clients, staff, and visitors, screening testing, also known as surveillance testing, response testing, quarantine, isolation, and cohorting of residents and staff, a named infection control lead person, infection control plans, PPE, staffing, communication, and a memory care or section for serving residents with memory care needs who would typically have difficulty in quarantining and following preventive measures. Per general industry safety orders in Title 8, Section 5144, in any workplace where respirators are necessary to protect the health of the employee, or whenever respirators are required by the employer the employer shall establish and implement a written respiratory protection program with worksite specific procedures. Your respiratory protection plan should include procedures for selecting respirators for use in the workplace, medical evaluations of employees required to use respirators, fit testing procedures for tight-fitting respirators, procedures for proper use of respirators in routine and reasonably foreseeable emergency situations, procedures and schedules for cleaning, disinfecting, storing, inspecting, repairing, discarding, and otherwise maintaining respirators. Also, your plan should include training of employees in the respiratory hazards to which they are potentially exposed during routine and emergency situations, and training of employees in the proper use of respirators, including putting on and removing them, any limitations on their use and their maintenance, and a procedure for regularly evaluating the effectiveness of your respiratory program. Your COVID mitigation plan and respiratory protection plan training should include training at the time of orientation, anytime there's a change to the plan, definitely before COVID is present in the home, and reviewing at regular intervals. You'll want to keep records of who attended trainings, what they were trained on, and when the trainings were held. One of the toughest areas to plan for right now is staffing. We've put together a list of some resources you might want to look into. Our advice is to do so now. As many of you have experienced, staffing can quickly reduce to just 1 or 2 people during an outbreak, and oftentimes it's not enough to keep things afloat and meet the needs of the clients, let alone give working staff adequate rest periods and time off. So you might look at some local staffing registries. CCLD did provide a list of staffing registries, which unfortunately, they are mostly in the Sacramento and Bay areas, but I do know some of them will travel to our area if you need staff. But a contract needs to be set up ahead of time. It's hard to do on the fly when an outbreak occurs. Also, home care organizations, and the ones that I am aware of that are available in our area are Addis and Arcadia. You may consider having an MOU with other providers so that you can borrow staff when there's a staffing shortage or staffing crisis. Temporary staffing agencies may have some staff available for use. Job fairs would be a place where you could maybe meet some new hires. Colleges where there are individuals who might be seeking work. And maybe working with nonprofit, community, or faith organizations in case you need to access staff on an urgent basis to have those individuals available. So let's talk about how your plan and sufficiently implementing your plan is going to protect you by going over Cal OSHA and CCLD inspections, investigations, and citations. When inspections of your work site or facility occur, they will be looking to ensure that the facility is clean, safe, and sanitary. The care and supervision provided shall be as necessary to meet the needs of the clients. They want to know that the licensee is not engaged in conduct that is harmful to the health or safety of the individual in the facility, and that you're complying with health officer orders and government agency requirements. Hand washing areas and bathrooms should be maintained in a safe and sanitary condition. And the use of common towels and washcloths is prohibited. The licensee should ensure each person in care receives needed medical care. A person in care who's suspected of having COVID must be isolated and regularly observed for changes in physical functioning, and any deterioration of health should be brought to the attention of their doctor. Each client in care will have personal rights, which include the right to be accorded safe, healthful, and comfortable accommodations, and the right to receive or reject medical care or health-related services, as well as the right to have visitors. There should be adequate staff to meet clients' needs, and staff are trained in sanitation principles, universal precautions, recognition of early signs of illness, and the need for professional assistance. All staff must be in good health, and any staff with evidence of any illness that poses a threat to the health and safety of persons in care should be relieved of their duties. Inspectors and investigators will look for policies and procedures and a mitigation plan to prevent disease and control infection, or to care for someone with COVID infection. And they'll want to know that cases and outbreaks are reported to the appropriate licensing authority, the authorized representative of the person in care, and the local health officer. CCLD is issuing citations to individuals or companies who are not following their COVID mitigation plan. An example of this would be any person who has COVID-like symptoms who's allowed to work, and any supervisor who allows an employee with COVID-like symptoms to work. Consequences can include exclusion of the employee and/or supervisor from working, which would also exclude them from working in the future at any CCLD licensed facility. And also, citations oftentimes come with financial penalties for the provider. CCLD is also cross-reporting to CDPH, Cal OSHA, and licensing boards such as the Board of Registered Nursing and the Board of Vocational Nursing and other certification boards. Here are some examples of citations that have been made by Cal OSHA to CCL residential and day program licensees and their fines. Employers not immediately reporting an employee death from COVID that was related to an outbreak in the facility for a fine of $5,000. Failure to implement COVID prevention plan and failure to exclude an infected employee from work, $20,000. Failure to track and respond to exposures in the workplace. Failure to notify an employee of their exposure, and failure to investigate contributing workplace risk factors, $20,000. Failure to develop and implement a respiratory protection plan. Failure to train staff on N95 use. Failure to provide medical evaluation for N95 and fit testing for N95, $20,000. Failure to identify job categories with risks of exposure. Failure to maintain source control, such as wearing masks and cough etiquette and hygiene. And failure to screen and refer exposed employees, $20,000. As you can see, these fines can really add up, and they pull from the same basic things that are required in your plan and that you are supposed to have in place. Now let's open up the call for question and answer. Feel free to unmute and ask questions or type your question in the chat box. Hi, Marge. I see your question in the chat box asking if we have the program for reimbursing fit testing yet. I was actually just thinking about that, and I apologize. I haven't heard back from Diana Anderson, but I know she was working on getting that put together so that we could offer some reimbursement. We do have a resource available for fit testing in our residential facilities, but at this time that reimbursement program would be what we'd be looking at for like SLS or ILS. Hi, Leah. When will videos become available? Great question. So we actually had our first recording on our last call, and I know that it's with our IT unit, and I'm hoping that it's going to be on our YouTube channel by the end of this week. I will be also sending over the file for today's recording, so hopefully within the next week or two, we'll have today's on there as well.
And this is Marge, and I'm sorry, but I think I must not have heard your response to my question. Could you repeat it again?
Yes, about fit testing. Yeah. So I do apologize that I don't have an update on our reimbursement for fit testing. I know Diana Anderson was working on that. But I haven't heard anything about it being set up and ready to go yet.
This is Dr. Austin. So what's being said, and I don't know the exact terms, but people who have an ability to get reimbursement, there's a, and I can look it up during the questions and I can pop back in and be more specific. There is a way to submit and be reimbursed. It does have to be linked to specific clients when when you ask for that reimbursement. But give me like 5 minutes and I will pull up the proposed policy and get back to you.
Thank you.
Thanks, Christy. And Alicia, I see your question as well, also regarding fit testing. We did call around trying to locate places where people could get fit testing done. And I'm sure that I probably didn't manage to call all of the available options in the Susanville area. Generally, any kind of a company that does like pre-employment physicals would be an option, and I would start with calling those places there in Susanville to see if they offer fit testing. Sometimes the local hospital will do fit testing through their employee program. Otherwise, we can try and come up with a plan to offer fit testing in that area. I realize it's pretty rural and it's pretty limited, but it is what's required. So hopefully there's some options available to you guys over there.
This is Dr. Austin again. So what is recommended is if you are vendored with the regional center, you will need to be vendored for service code 024, which is purchase reimbursement. And then there's a process to be reimbursed for the fit testing through that vendorization.
Wonderful, thank you.
Christy, I have a question. If that is needing to be specific to a client, then I'm assuming it would need to be because the client is in quarantine or isolation? Or could we do it
No.
in advance related to
You do
clients?
it in advance. You do it in
You can do
advance. It's to protect the client in the
Okay.
future.
Very good, thank you.
Wonderful, thank you. That's great news. So that's an option as well, and that will hopefully open up some doors for you guys so that you can have that done. I know. Oh, go ahead.
And how it would be done is the provider would request funds for fit testing from the service coordinator. And if they aren't already vendored for purchase reimbursement, then an application would be submitted to community services through form 067. And once the provider completed the vendorization process, if they are already vendored for purchase reimbursement, the SC sets them up to reimburse. And again, it needs to be linked with at least 3 clients your agency serves.
Great. And I know on one of our recent calls, we did have a few options for places to get fit tested. Alicia is probably not going to help you a lot, but the Reading Occupational Medicine in Reading, they offer fit testing, and Enloe Hospital also offers fit testing. There's another place in Orville, and then there's a clinic down in the Rockland area and Sacramento that also do fit testing. So feel free to unmute if you have questions, or go ahead and type in the chat box. Okay, well, I don't see any more. So if you'd like, we can go ahead and move on to learning a little bit about the risks of COVID for women who are pregnant. Let me just, thank you. So sources of this information were researched from Johns Hopkins University, the American Academy of Pediatrics, the Centers for Disease Control, and the American Journal of Obstetrics and Gynecology. A study published in Biomed Central in April 2021 looked at 22,493 women ages 18 to 44 years and found the risk of hospitalization of non-pregnant women who contracted COVID to be 17%. By contrast, the risk of hospitalization of pregnant women in that study was 60.5%, or 12 times the risk of non-pregnant women. Another study by the CDC found the risk for non-pregnant women to be 5.8%, and pregnant women had a 31.5% risk of hospitalization. Pregnant women were twice as likely to die from COVID. In another study conducted in Washington State and published in the AGOG, pregnancy increased the fatality rate of women by 13.6 times. Possible reasons for this increased risk is that pregnant women have a suppressed immune system, decreased lung capacity, and increased heart rate. In that study in Washington, 45% of critically ill women experienced preterm birth. The risks for women who are pregnant goes during pregnancy and up to 42 days after pregnancy. And they have more hospitalizations, intensive care needs, and require mechanical ventilation more often. Statistically, preterm birth occurs in 12.2% of pregnant women who contract COVID. And other poor outcomes such as pregnancy loss occur in about 2%. Factors that increase the risk of serious illness, hospitalization, and death in pregnant women are having certain underlying medical conditions, such as pre-pregnancy obesity, chronic lung disease, chronic hypertension, or pre-gestational diabetes, being older than 25 years old, living or working in a community with high transmission, such as healthcare occupations, some racial and ethnic minority groups with limited access to healthcare are higher risk, living or working in a community with low vaccination levels, and working in places where it's difficult or not possible to keep 6 feet of distance from others. So how have COVID vaccines been determined to be safe for pregnant women and their unborn children? Animal studies performed for Pfizer, Moderna, and Janssen showed safety and efficacy of vaccines. Data from 3 different safety monitoring systems have been analyzed by the CDC. There's also the V-Safe Pregnancy Registry, which looks at vaccines effectiveness, but also side effects or adverse reactions. Vaccination was found to lower the risk of infection with COVID for pregnant women, and antibodies produced after vaccination may cross the umbilical cord and provide protection to the infant. Vaccines for COVID-19 cannot cause infection, and vaccines for COVID-19 do not alter DNA. If anyone is interested in more information on COVID-19 vaccines and pregnancy, you can talk to somebody at Mother to Baby, and the number is here on your screen, or you can chat with someone online at www.mothertobaby.org/askanexpert, or you can email them at contactus@mothertobaby.org. If you're pregnant and vaccinated, or you know someone who's pregnant and gets vaccinated, they can sign up for the V-Safe Pregnancy Registry at the V-Safe website. And that concludes our presentation today. So I can open it back up for question and answer. If anybody else has any questions or concerns, anything you want to talk about today regarding COVID or any of the information that we shared on the call.
I have a question about the respirator training or respirator fitting. Is it just one person who needs to be trained on fitting, or is it all employees? What's the stat?
Yeah, that's a great question. So actually they have on the CCL calls and the CDPH calls, they've talked about that not everybody necessarily has to be fit tested. Obviously, if there's a chance that an employee is going to be asked to wear a respirator, then they need to be. But like, for instance, at day programs where, you know, the chance of exposure is more related to, like, if you find out someone's positive or symptomatic while they're at program, and then you have to move them into an isolation room while they're waiting for their ride. You could just have a select few people who were fit tested and provided that care to the individual while they were waiting. For a residential facility, I think that it would probably be best if everybody was fit tested, because due to staffing shortages and situations, you know, being in the house with, you know, with an outbreak going on, I think it's best if everybody has been fit tested there. Does that answer your question?
Yes, thank you.
Yeah, okay. And so you have a question in the chat box. If someone receives an exemption, they need to get tested every week and wear a surgical mask. Yes, that's correct. So anyone who's unvaccinated, they should be getting tested weekly and then wearing a surgical mask as opposed to a cloth mask, because a cloth mask isn't going to provide the same level of protection. But also the surgical mask ought to be a FDA approved surgical mask. And on the FDA website, there's actually a really long list of all of the different brands and item codes that are FDA approved. And Katie, hi. You know, we don't typically give out the PowerPoint, but this call is recorded and it should be posted on our YouTube channel in the next week or two. So I can certainly go over any information that you missed if you'd like. Okay, well, I'm more than happy to, of course, answer any questions. Nellie and I are always available. If anyone ever has a question and you want to reach out, please feel free to call us at the office or shoot an email over. All right, well, if there aren't any more questions or comments today, I'm going to go ahead and end our call. I want to say again, thank you so much for coming today, but thank you even more for all of the hard work that you do in these really challenging times. We certainly appreciate everything that you do for our clients. And we're here for you if you need any assistance or help or have questions, please feel free to reach out. And I hope you have a wonderful day. Hey, Alicia, I just saw you asked about the YouTube address. You know, I think you just look up Far Northern Regional Center on YouTube and you ought to be able to find our account on there. It's really new. So it's a new technological age for the regional center. We've got a YouTube channel. So I think you can just search it and probably find it that way. All right. Thanks, you guys. Thanks, Nellie. You did great.
Thank you, Jen.